I'm Allie. It's nice to meet you if we haven't met already. I am a practice owner. I have a multidisciplinary clinic here in North Vancouver, which is physiotherapy, chiro, massage, natural. Oh, it used to have naturopath, but then we were just talking about this actually. Dr. Julie Durham, a friend of mine, opened up in the same complex as mine, and she's an ND, so she does the ND thing. And I've got midwives and counselors and a little bit of everything in that practice. And I'm also co-founder of Jane. So that Jane originally was built for my practice canopy. And then we built it out into something we could license to other people, which means that I get to work with all of you and Brandon, which is super lovely for me. So so glad to be working with you this morning. And I think Brandon and I last spoke a year ago at Allied last year. He did a session, and this year I'm excited to go through the content of what is a virtual receptionist versus a virtual administrator. I'll let Brandon introduce himself and tell you a little bit about why he's such an expert on the subject.
Hey everyone, thanks for being here today. Yes, as Ali said, I'm just here to kind of give you guys a brief idea of what the difference is, I guess, between a receptionist and a virtual assistant, and just kind of help you guys navigate the waters in terms of what to look for when you're actually searching for one and how you can best find one. So that's really what I'm going to be diving into today, and hopefully some of the content you guys can take away and go with it into your search and finding out better ways to improve and grow your guys' clinic. So what I'm going to do is I'm going to just do a quick screen share, jump into the presentation, and we will go from there. All right. So like I said, today we're going into virtual reception versus virtual assistant. What's the difference and actually how to get the most out of each? So what we're actually going to be covering, we're going to be covering what a virtual receptionist is, what a virtual assistant is, what the difference between the two, and I'm also going to give you guys 5 tips to get the most out of your virtual assistant and 5 tips to get the most out of your virtual receptionist. And once we're done here, we're going to do just a quick live Q&A so that you guys can get any specific questions that you want answered. So when you do actually ask a question, if you can, just throw it into the Q&A versus the chat. That way we can go back and look at all the questions, making sure that we don't miss anyone and we can get through all the questions properly. So what actually are virtual assistants? So I know in today's world, virtual assistants, you think someone that you can hire remotely to help you with administrative work. But what an actual virtual assistant is, especially in today's landscape, is someone that you can hire who's simply working remotely that are going to do specialized tasks within your clinic. So a virtual assistant actually should always have expertise in the area that you do need help. And I say this because you're looking for someone who's going to add value to your practice. And really the main purpose of a virtual assistant is to help you better balance your time by helping you take care of highly specialized and time-consuming tasks. So what can an actual VA help you with? Everything from labs, blogging, newsletters, direct billing, helping build your website, email management, social media management, as well as helping you do some advertising online. So as you can see there, the list is actually quite diverse. It's not simply about helping you do things in the clinic. It's actually about how you can help grow your business from an entirely virtual standpoint. So the thing that a VA can do is very highly specialized, and they're fantastic at being able to help give you some navigation and some expertise, ensuring that you know how to properly execute specific things within your practice. So what actually is a virtual receptionist? So a virtual receptionist is generally a team member or service that you're going to hire to help managing your incoming calls. They specialize in customer service and bookings over the phone. So really the main purpose of a virtual receptionist compared to a virtual assistant is they're going to help you improve your ability to answer the phone, help questions with clients, and help you manage your appointments. what can the VR help you with? So VR being virtual receptionist. So they're going to help your clients with questions. They can help you do call outs. They can help you manage your bookings, wait list, transfer and direct calls in and through the clinic, making sure that they're all delegated properly, cancellations and rescheduling, and also ensuring that you always have some consistent and reliable front desk staff who are going to be there to really provide customer service for your clients. So the main difference here is a virtual assistant is going to help you with those highly specialized needs. So they're going to help give you some expertise on how to maintain and develop workflows for the complex things within your clinic. A virtual receptionist, their focus is really on the front lines. They're your customer service team who are going to manage your daily call flow, ensuring that you're going to be booking appointments while you're actually in appointments. So 5 tips to get the most out of a virtual assistant. So the first things that you're going to be looking for is you need to be specific, you need to set expectations, and you need to create a scope of work. So all of these tie together because they set the tone and give clear definition of what the framework is going to be and the results of the work that you want done within the specific time frame. So something that you should be saying to a virtual assistant in terms of being specific with what you need done. I need to increase my Instagram profile by adding 100 actively engaged users over the next 90 days. Or I need you to build 5 email templates for my monthly newsletter within the next month. Something that you might not want to say because it doesn't give any specifics and doesn't allow you to hold your virtual assistant accountable would be, I need to increase my social media following. With something like that, in terms of creating a scope of work, that leaves it open to so many different avenues, because with today you have LinkedIn, you have Facebook, you have Instagram. Like when you say I need to increase my following, it's really not a specific enough project for them to be able to actually deliver for what you need. So you have to really tell the virtual assistant exactly what you want and when you want it done. So project limit and portfolio check. So these 2 things here are actually very crucial as well. And the reason I say that you should be doing 3 projects per quarter as your limit, it's not necessarily that a virtual assistant can't handle more, but you being a clinic owner, it's more about you prioritizing how much you can do each quarter, because a virtual assistant can really handle anything you throw at them. It's just a matter of can you. So it's a matter of you prioritizing what are the 3 most important things that I need to get done that I actually don't have the time to do, and how can I help outsource that with a professional who's an expert in what they need to do. The next thing that you're actually going to want to do is a portfolio check. This is the same thing as a reference check. It's about seeing the work that they've already done in order to prove that they say they're going to do what they're going to do and they can actually do it. So in the example of the Instagram profile, essentially, if they're telling you that you want to increase your profile by 100, there's a specific target that they can reach in 90 days. And then you can go to the portfolio and actually check the work that they've done to see if this is something that they have actually accomplished in the past. Where can you actually find a good VA? Fiverr and Upwork are very, very common. These sites are actually very good if you want to look for a virtual assistant to find project-based work. So if you're looking for something specific that you need done, like you need to create and set up an email newsletter, Fiverr and Upwork, those types of services and platforms or communities really, you can actually create a scope of work, publish it, and then have virtual assistants reply back to you. And then you can actually pick between the best ones that work for you based on their references, their capabilities, and price point. The Ginger Agency, actually, who's based out of Vancouver, is also a great option for naturopaths and wellness practitioners who need help with specialized ongoing virtual assistant support. So everything from email or direct billing or labs, where that type of work needs to constantly be done and constantly be monitored. The Ginger agency is absolutely fantastic. So 5 tips for getting the most out of your virtual receptionist. So first, you want to keep it simple. Second, there has to be structure within your instructions and how to handle calls appropriately. Third is communication. Communication. It is probably one of the most important things to consider. 4, know your phone system. And 5, a cost analysis. So we'll dive into a little bit of all of these just so you guys can get a better idea of what that actually all means. So keeping it simple with structure. So simplicity simply means that the main purpose of a virtual receptionist is to answer your phone, help with questions, and book appointments. For your customer's sake, it really actually shouldn't be any more complicated than that, because when a client's calling in pain, they want to get in, they want to see someone as quickly as possible. So the more simplicity in the process and workflow to actually get in to book an appointment, the more easy it'll be for you to actually increase your revenue opportunities by allowing a receptionist to become more efficient for you. So in terms of structure, your call instructions really need to be very structured in a way that is easy to help the patient. A virtual receptionist needs to be able to be confident in navigating all the booking rules quickly and effectively. So I guess for an example, let's say there's a patient calling in and they're looking to book a massage. So that is an example of someone who already knows what they want. There's really 3 main scenarios that could potentially happen there. They're going to be asking for a specific practitioner based on experience because they've gone to them already, or a reference because someone recommended them. They want the quickest time slot available because they're in pain right now and they want to get in as quickly as possible. Or it's location based. Are you close enough to where they are and can they get to you quickly from work? Or do you guys have multiple locations? Then the other scenario that happens quite often would be a patient who's calling in and they're unsure of what they need. They're feeling it out. They want to get a better idea of, is this going to be the right fit for me? So where a virtual receptionist can help in that sense is, the one thing to really know is that a virtual receptionist is a receptionist. They aren't a practitioner, so they shouldn't be diagnosing over the phone and helping with that. However, what a virtual receptionist can do is they can help probe a little bit for you by asking simple questions based on certain things that the client is saying. So the nice thing that you can do with probing is you could actually have a structured list of probing questions that a receptionist could ask for you to maybe better help navigate the patient so that they can figure out which type of service they need, really. One other thing that you can do is actually create action scenarios. So if a patient's calling in and they're describing back pain and it's muscular, where should we go for that? Is that massage? Is that physio? You specify with your receptionist on what would be the best route for them to get booked in for. Another great alternative is having a free consult, a quick 10 or 15-minute free consult where if the patient really is unsure and they need to talk to someone to really dive into it, a free consult is always a great way to get the patient in the door. And then once you've established that trust with them during that free consult, they're much more likely to book and continue coming back. Because that's really the most important thing when you're first connecting with a client, is just establishing that trust. So like I said earlier, communication with a virtual receptionist is really the most important thing, because a virtual receptionist that knows about your vacations, knows about your sick leave, or if there's a new practitioner who just came on board, is far more valuable than a receptionist who actually has no idea. And the only way to communicate is doing that daily back and forth. So your receptionist actually should know everything that's going on in the clinic on a day-to-day basis from an administrative standpoint, because they're the first point with your clients and they always need to be in the know. So a quick cost analysis in terms of what you guys can do to actually figure out some of the math and find out, is a virtual receptionist even going to be effective for my clinic? So actually doing the math is very simple. All you actually have to do is figure out how many calls you're getting a day, how many days of the week do you need coverage, and then add those together and multiply it by 4, and you're going to get a rough estimate for how many calls you're getting per month. So based on some of the data that we've actually accumulated over the years, so this is the rough estimates in terms of call length averages. So a new patient booking, roughly around 5 minutes. An existing patient booking is roughly around 4, and a non-booking call is roughly around 3. So with that data there, you can actually go in and give yourself an estimate of how many calls and how many minutes you're using on a monthly basis, so that when you go out and search to find out what service is going to work for you, you can actually give yourself a pre-estimate of, okay, this is going to be the rough estimate of what my monthly cost could be for this. And as you can see in the graphic on the right, I've actually done just a quick cost comparison so that you guys can actually see some of the real numbers. So if you're looking at an in-house receptionist who works 40 hours a week, you're paying them about $20 an hour. And let's say they're answering 15 calls a day, that is about $3,200 a month. And for the same level of calls answered with a reception service, it's roughly about half. So in terms of the savings, you can use the extra money elsewhere within your clinic for any other purpose that you really need to, because the cost savings are so much. So what to look for when you're doing research and trying to find out, okay, is this service going to be a good fit for me? This is from my experience when I've actually talked to so many different services who offer reception services. You want to look for a pay-per usage model. And what that essentially means is you're going to pay for reception time that you use when you actually use it. You want to look at the contract terms and conditions. As we know from the past year, things change quickly. So, and I know for a lot of you, you had to close things down. So you want an option to get out and close things up without any huge fee. You also want to look for hidden fees when you're doing your research. You want to look for things like wrap-up time, holiday fees, tech fees, service fees. All of these things are extra fees that services add on to basically lower the upfront cost to make it seem like they're cheaper than they really are. So that's one thing that you'd want to pre-ask anyone you're talking to. What do these look like? Can you break them down for me? And in terms of just another quick cost analysis for a first-time caller. So if you're looking at a first-time call with a virtual receptionist, you're looking at about $850 for that call. The average cost for a 60-minute massage in Canada is $100. And the average person gets about 3.5 massages a year. So by potentially missing that first call, you're actually leaving a potential $342 of profit on the table just by simply getting that first call. So that's really where answering your phone as a clinic owner is one of the most important things you can do to stimulate growth. So that's kind of the basics of what the difference are between a virtual assistant and a virtual receptionist. So if anyone has any questions, throw them in the Q&A. I'm happy to answer any specifics as we go through just a quick live answer session here. And then my contact info is up on the screen. And then I also have a direct link if anyone would like to book in like a direct consult with us. We'll give you guys a free consult to find out, is virtual reception a right fit for you or not? We can discuss all the specifics of your practice. And all of this info will be in the bio of the session after it's all done. And what I'll do right now actually is I'm going to throw the direct link into the chat here.
Brandon, this was so great. I have like 2 pages of notes, and I have some questions for you before I'm going to let anyone else join the Q&A, because I get special rights since I'm hosting.
Yeah, for sure. So I'm happy to answer anything. Hopefully I can.
I'm sure you can. You know what? Actually, first of all, VA is more than I thought. Like the role of a virtual assistant, it was interesting to see like just the number of things that they do. And then I really liked your advice around specific time frame and measurements. So like approaching a VA without just saying like don't just say like the overarching idea that you have, but then the specific way you want that measured to show success.
Yeah.
And we deal with that a lot, even especially as a remote workforce at Jane. Like, how do we make sure that our people at Jane are achieving tasks in the way that we're hoping that they will, and that we're all communicating well, and that we're all kind of rowing in the same direction and going after the same goal. And I loved that. And I loved when you said, yeah, they can do a lot of things, but can you? Like, you still have to manage those projects. You still have to give your approval. You still have to, like, you know, there's extra communication required. So I liked that, like narrowing your scope, maybe choosing 3. It made me wonder whether a VA project worksheet would be helpful. You know, where you say, what do you want to accomplish? How are you going to measure it? These are the 3 things. What's the timeline? Like just a little worksheet that people could fill out and provide to a VA and say, these are the 3 projects I want done. So
yes.
Yeah, I was thinking we could work on something, maybe like a worksheet.
Yeah, that's exactly it. Where the more specific you are in the goal you want to achieve and the timeline, the more you can really narrow down a successful VA, because that's when you're working with someone who's remote, the more you can hold them accountable to what needs to be done, the less stress on your shoulders and worrying about, okay, what's happening? Is this getting done? Because not being in face to face with someone every single day, sometimes things can slip through the cracks.
And then I was just thinking, do you have people that use the VR, like a virtual receptionist, just outside of their practice hours? Like they'll have admin staff working the 9 to 5, but then they'll have it routed to virtual reception around the, like maybe Sunday if they're not open, or around the evening.
That's actually very common. So kind of the 2 main concepts is, you as a starting practice who can't afford to hire someone full-time just yet, they'll have virtual reception as their main choice. But then as they're growing and the clinic is scaling, they transition to having someone in-house. And the nice thing about virtual reception, they become a good complement to the actual in-house receptionist, where they become your full customer service team, where the in-house receptionist is kind of managing all the admin work day to day. And then the virtual reception team is handling the calls.
Yeah. Okay.
The calls can be very distracting for someone who's working on projects for you in-house.
Yeah, interesting.
Trying to build your workflows, because I mean, if you're working on a project and how to build like all of your workflows out, and then a phone call comes in and you get distracted, it takes roughly 25 minutes to get focused back into the project you were working on, and your day is shot.
I have two more things, and then there's the last 15 minutes I'm gonna give to all the Q&As of the people in the audience. But
yeah, for sure.
The first one was, I really liked the idea as well that you have to keep everyone updated. Obviously, you need to keep your virtual receptionist team updated on like vacations, or you know, how you want things to flow.
Yes.
Wondering if you had any examples of the probing questions you mentioned. Like you said, so you go through a flow of it. The second scenario is obviously harder. If someone calls and says, I want an appointment with Dr. Joe, you're like, great, I can do that. But if someone says, I just don't know what I want, I just think I need something, how does the probing questions you mentioned, do you have any examples of what sometimes those are, the flow that people go through?
Yeah, so like the thing with probing questions, they need to be very simple. And it's like, think of it, the language for a receptionist and your patient who maybe don't really know the specific nuances and all the details of the actual discipline, where it really needs to be simple. Because when a patient's calling in, they're not going to be describing exactly what the actual problem is. They're going to be describing what their pain feels like.
Right.
So a probing question for us would be somewhere about, how can we localize it to a specific area for you, so that you know where to focus when you're doing maybe like, we can probe to get more information so that we can then book them for that free consult, so that when you then call them back, you have all the details ready. And what I mean by that would be, if someone's describing like back pain, That's very generalized. And a probing question for us could be, can you be a little bit more specific in terms of where the location of the back pain is? Is it kind of on the lower left side? Is it closer to the spine? Things like that, so that when you go back in, you just have a better, more clear picture
Right.
talking to the client, so that you're more ready to give them better advice.
So you can give a little bit of a script, maybe to say like,
Yeah,
how long
and
has it been hurting? How intense?
right. Yeah, you can do a little bit more scripting in terms of like, here's the general guideline, and the best practice with the receptionist is try to avoid word for word scripts. It's
Yeah.
more about
Okay.
create scenarios so the organic conversation can happen, so it feels more like a person.
Yeah, I love that. Okay, and my last point I wanted to say, which I just thought was so valuable and really interesting, especially in this more distributed age, was the idea that if you add a VR receptionist that may be providing like a phone screen or a telehealth screening call is would be like just such a nice compliment. So to be able to offer the virtual receptionist that maybe doesn't have the ability to go and ask every question that they have to the practitioner, but to say, I can book you in for a 15-minute telehealth consult, and then we'll just decide what is the best like course of care for you. So maybe
Yes.
if you don't have that in your practice right now, because it doesn't make a lot of sense for you, but a screening call, a quick 10, even a 10-minute screening call that you can authorize the virtual reception team to book in, it just might be a nice complement to virtual reception.
Exactly. And that 10 minutes is invaluable when you think of the long-term value of a client, where if you truly establish the trust right up front and make them feel comfortable and like you're the right person for them, then you've got the trust. And that's really one of the most important things. And those consults can really add that.
Well, and I always say that as soon as someone books an appointment, they stop looking. But if they don't manage to book the appointment, they're going to keep looking
Mhm.
if they're looking for care. And so even just if you can't figure out where to put them or getting them to an actual appointment, that phone screen will be enough for them to stop looking. They're not going to keep looking if they had that consult booked in. So that's
Yeah.
interesting. I know I'm like, I think I might see it. I haven't even talked to you about using Smiledog for like outside of office hours, but now I think I'm like, let's talk after this, Brandon. Okay, lots of good questions coming in here in the chat and the Q&A. I don't know if you want to pull them up and take your pick.
Yeah, sure thing. Okay, so what would be the best approach for this? Just start from the top and work our way down?
Yeah, let's see. How about, there's lots of questions about pricing. I've seen quite a few questions about pricing. So let's start with a few of those. How would you figure pricing for a front desk who also does work from home when not in office? So Jason, it sounds like what you're talking about is actual like internal staff being hired that you want to use as an administrator as well as answering phones from home. And I think that's a little bit of a different scenario because that's not an actual external business that you're hiring. You're just hiring an employee and asking them to work kind of not standard hours. So that has a different.
Yes. So Jason, in terms of what you're looking for, if I'm interpreting it correctly, you're looking to figure out how can you pay your front desk staff who you've hired. It's part of your team, but they're just working from home. Really, it would be by the hour, because if you don't have the systems in place to track everything like on a per minute basis, it's going to be very complex to figure that out. And someone working by the hour is just going to make them a lot happier. I have known a few companies out there who actually have switched to the model that you're kind of talking about, and they're actually paying their staff by productive minute. So they're working 10-hour days, getting paid for 5. So it's a very big hindrance in terms of keeping someone motivated and happy.
Yeah, it's really hard. And you also have to have like averaging agreements. There's lots of labor laws around how long people can work and how much time they need to have off in between work. And if they're not going to work a consistent schedule, there's labor laws around that. So just be aware of that. I was laughing thinking about the early days of Jane because I had our phone was routed to my cell phone, like before we had any team, and it was just me. And I used to be like out for a run, and then I'd pick up the phone and talk through a problem with someone on the side of the trail. And I'm like, oh, I should have just had I should have talked to Smiledog back then too. Like, just book me in for a time instead of me doing this on the side of the trail.
Yeah.
People are asking, are you available? Is it US and Canadian? Or where do you service this for Smiledog?
Smiledog's we cover all of North America, actually.
All of North America.
Yeah.
And so is your pricing US dollars or Canadian dollars?
For Canadian clients, it's Canadian. For US, it's US.
Same with us. I'm like, what, you make your money in?
We love our Canadian clients.
Yeah. And then some people are asking if it's in the same time zone. What about time zones for you? Your staff are all out east, right? Or
yes, yeah. So our time zones, we have our hours set up so that we can cover anywhere in North America 9 to 5, and the specifics are based on your time zone. So for example, Toronto, it would be 7:30 till 8 p.m. Monday to Friday and 9 to 5 on Saturdays. But it just depends on the time zone. And in terms of specifics, you just have to make that calculation because we're 4 hours ahead of you guys, actually.
Yeah, I know. And it changes at different times of the year, doesn't it?
Yes. So there's one question in here that Kimberly asked, I think would be a good to answer because it's actually something very important. So Kimberly asked, how does a virtual receptionist or assistant have access to the clinic's telephone?
Yeah.
It's actually much simpler than you'd think. It's through call forwarding. So if you have a virtual assistant or a virtual receptionist, you're going to call forward your clinic line over to their number that they set up for you. And with a service, they're going to give you a custom line. And with someone that you maybe hired working from home, you'll transfer it to maybe their home phone or their cell phone. And the one thing to note about this is you really need to know your phone system and how easy it is to turn call forwarding off and on. There's nothing more painful than trying to figure that out with someone like with a company like Rogers or TELUS and just taking 45 minutes to answer a simple question. So the more control you can have over your phone system and being able to change and configure settings yourself, the way less headache for you guys.
I know that it was, I used to do this when one clinic was closed. I would forward it to my other clinic. And so that desk would take the calls for both. And it was really simple. It was like you hit star something. I think a lot of
the most common is *72, and that just gets the call forwarding. The thing today though is every service provider is something different, and then it all depends on, do you have a home phone? Do you have a cell phone? Do you have a business phone? They give you a bunch of different codes. And then every rep you talk to is, I don't know if we even do that.
No, I know, but I mean, the online help is pretty handy. But yeah, so you would have to, you're going to be routing all your calls. It's not like, so you'd have to be routing all your calls during that time to your virtual reception. And then when you turn it off, all those calls are going to come to your front desk.
Yeah.
There's no kind of mix and match. Yeah, that's a great question.
There's another one in here from Mary Joan. So she asked, is it possible to hire a VER for short-term coverage when regular admin staff are on vacation? Yes, definitely. Yeah, that's definitely a possibility. And that's something that most services will offer. It's just a matter of figuring out what their terms are and how that looks for short-term coverage. Most will do usually, so let's say your regular admin's going on vacation for 2 weeks. That's actually an extremely short time frame. So most services will do about a month for you. I know, like what we offer is we do like a month vacation coverage. It's just a pay-as-you-go 1 month plan. You get 30 days of service for that 2 weeks of coverage that you need, and you just pay for time when you use it.
Yeah, that's a great one because it is a really tricky thing when if you have only one admin staff or just one at a time and they go away. I was thinking about that with like Jane having like a locum listing, like how can we help with that problem? Because it is incredibly tricky. Usually you have no admin staff and it doesn't go very well. It's hard to train someone up for just 2 weeks.
Yes.
Okay, awesome. And I remember you telling me all about the technology that you use at Smiledog, and it's really amazing where it's very easy for everyone that's working for you to be kind of customized to the person whose call they're answering. There's a lot of information that they get automatically displayed that explains like what the clinic is offering. And so it doesn't feel like a generic phone line, but you're really getting informed reception.
Yeah, definitely. I can show you just a quick sample if you guys would want, just to see how the layout. If I'm not sure if that would be beneficial or not, but I can show you the quick layout. But in terms of our customization, we have a general structure, but within that structure, we want to cater it to basically best fit you guys so that we can handle the call flow effectively for you. And that's exactly it. We're going to be answering on behalf of you. So we want to essentially try to become part of your customer service team because the phone calls was that first touch point for your clients.
And this is Eva has a question about that too. Is it considered you have a profile within a Jane account that's limited to just kind of scheduling?
Yeah, that's the most common way we integrate with Jane, where you'll set up an admin profile and then we'll have access to the schedule to be able to like do new bookings, existing cancellations, wait lists, do payments like when we build out their contact profile, just in an administrative fashion so that you can keep all of their private data outside of you. And then the other common would be us just using your main login. But the most common is creating a separate admin.
Yeah, which we don't recommend. We definitely would recommend. You can create a user called Smiledog reception. And then
that's the best practice for that.
Yeah, because then, and there's no charge in Jane for administrative profiles, so it's not an extra cost to you. And then you can actually track more effectively who's doing what, as well as you can restrict chart access.
Yep.
Those type, which is good for everyone because Brandon's team does not want nor need chart access.
Exactly. We want to be able to help you from an administrative standpoint and booking your appointments and ensuring that workflow is more smooth for you.
Yeah, exactly. Yeah, it's pretty simple. Okay, well, that was great. I always love chatting with you, Brandon. Do you want to see if there's anything else in the Q&A there that you want to cover? Otherwise, we can also send out some of these answers by email.
Yeah, we could definitely do that. And then if anyone's looking for more specific discussion, there is an option to schedule a free consultation with us in the link that's going to be posted that I threw out in the chat, which I can throw out again. So if you really want to discuss things in like much further detail, you can just reach out to us for a free chat.
Yeah, and then I will again mention that at 1:30, we're going to be talking with Dr. Jody, who works quite extensively with a VA. So if you want to talk to anybody, I think Brandon said he might attend the session just to get some more insights.
Because I'm very curious in terms of how she's been able to perfect that structure and workflow with a virtual assistant.
Yeah, and I know she's going to talk about, her and I are going to have just a back and forth chat. So if you want to attend or register for that to get the recording, that's at 1:30 today, 1:30 Pacific. So
yeah, I'll be there because it's going to be a really good session.
Yeah. Okay, awesome. Well, it's always a pleasure. I actually think that you're a great manager. All of your little tips here, I'm just like, this is what we need in management structure. I'm like, do you have
this is kind of how I applied the concept of this is, okay, you guys aren't just practitioners, you're business owners. And they're running a business is very tough and it's very, it can be exhausting. So I just kind of wanted to give a high level view in terms of like what things you can do, because hiring a virtual assistant or receptionist is just like hiring someone yourself. So using the same concepts and same practices are going to get you the same results.
I love it. Okay, well, we'll be sending the recording around, so don't worry if you missed anything. I know Brandon had a lot of good info on those slides and they went through quickly. But we'll send those around so that you have them. And then I hope I'll see you later today at some of the other sessions. Awesome. Looking forward to it. Have a great day, everybody.
All right, thanks so much, guys. I appreciate you being here.